Treatment options for hips can be simply anti-inflammatory medications, a localized corticosteroid injection into the hip, restricted activity, physical therapy. These are all conservative treatments for hip replacement, for hips themselves. Further treatment may require MRI examinations, CAT scan examinations, always conventional x-rays as well. Sometimes you have to do an arthrogram to see what's going on in the hip to assess whether there's loose bodies, labral tears, or other identifiable treatments such as a bone scan for avascular necrosis, which is a separate entity to itself. Surgical options for hips, now we're dealing with hips from an inflammatory or degenerative standpoint, not trauma with fractures, can actually consist of an arthroscopic procedure. Many times there are treatments such as labral debridements or shaving bone down for impingement. I think Lady Gaga had a recent surgery for that. But for the most part, going into the next phases for arthritis, you can actually have a hip arthroplasty done, which is joint replacement. There are approaches that are anterior that helps to prevent the dislocation of the hips, or the more classic lateral or posterior approaches. These are total replacements. You're replacing both sides of the hip joint for restoration of function, activities, basic lifestyle changes.